Black fungus new scare in India as second COVID wave ebbs. India battles a new challenge in mucormycosis, a rare fungal disease with a high mortality rate commonly referred to as black fungus. As a devastating second wave of COVID-19 ebbs with less than 100,000 new cases reported on Tuesday, India is now battling a new scare. Mucormycosis, commonly referred to as black fungus, is a rare fungal disease with a high mortality rate. On Monday, Health Minister Harsh Vardhan said the country had more than 28,000 cases of the fungal infection. Patients infected with black fungus at a government hospital in Hyderabad, file, Mahesh Kumar/AP. Health experts say India's poor air quality and excessive dust in cities, like Mumbai, make it easier for the fungi to thrive, terming the recent spike in cases a matter of serious concern. While black fungus has been found in India before, the current spike in infections is among people infected with COVID-19 and those who have recovered from the disease. Dr. Sumit Mrig, who heads the ENT department at Max Smart Super Speciality Hospital in New Delhi, told Al Jazeera they used to see 1 or 2 such cases in a week before the second wave of the pandemic. The numbers have drastically increased this time and at present, we are seeing 5 to 6 such patients on a daily basis, Mrig said. He said the outbreak has put tremendous pressure on the health infrastructure, especially on the availability of liposomal amphotericin B, the last-line drug being used to treat black fungus, and which he said has put tremendous pressure on the health infrastructure. Apart from the high mortality associated with disease which rapidly spreads from nose and sinuses to the eye and brain in a span of 24 to 48 hours, if treatment is not initiated on time, the patient can lose his eyesight. Liposomal amphotericin B is allocated to the states by the federal government based on the number of cases reported by them. A doctor performs endoscopic sinus surgery on a patient suffering from mucormycosis at a private hospital in Ghaziabad on the outskirts of New Delhi, Adnan Abedi/Reuters. Also last week, the Delhi High Court directed the federal government to form a policy on the distribution of liposomal amphotericin B drug. Medanta Hospital's Dr. Soin said that during the second wave of COVID, the fungal infection is affecting coronavirus patients 3 to 6 weeks after recovery, most commonly those who have uncontrolled diabetes or were treated with steroids. While steroids are life-saving for many patients with COVID, many cases could have been prevented if their diabetes was better controlled and steroid use was restricted, he told Al Jazeera. Dr. Jayaprakash Mully, an epidemiologist at the Christian Medical College in the southern state of Tamil Nadu, said irregularity in attending diabetic patients is a likely cause of mucormycosis. When a patient is diabetic and is admitted to a ward, usually repeated blood sugar checking is done and doses of whatever required drug are adjusted to control it. Experts suggest high-risk diabetics who have recovered from COVID-19 should be careful and any red flags should be immediately reported to an ENT surgeon.